practice implications and recommendations on provider communication techniques to promote childhood vaccine acceptance and uptake. This is performed by Group 2, Jessica Bacci, Darius Walinska, Shannon Land, Callie Milback, Kara Norelli, and Christina Vitale. The most significant advance in public health over the past century is vaccinations. The Centers for Disease Control and Prevention discuss how vaccines are responsible for diminishing many infectious diseases worldwide. Crippling and lethal diseases such as polio, smallpox, diphtheria, and rubella are all but a memory thanks to advances in the technology of vaccine development, their efficacy, and safety. This innovation in medicine has spared generations of families from facing and suffering through debilitating and fatal diseases. Vaccine hesitancy, also known as anti-vaccination or anti-vax, is a reluctance or refusal to be vaccinated against contagious diseases. It is identified by the World Health Organization as one of the top 10 global health threats of our time. The term encompasses outright refusal to vaccinate, delaying vaccines, accepting vaccines but remaining uncertain about their use, or using certain vaccines but not others. Arguments against vaccination are negated by overwhelming scientific consensus about the safety and efficacy of vaccines. Parental reasons for vaccine hesitancy are complex and may be due to more than a knowledge deficit. According to Shen and Dubé, parents who are vaccine hesitant far outnumber parents who are vaccine refusers. For vaccines to remain successful domestically, clinicians must evaluate and fine-tune their communicative efforts when promoting vaccine administration and its safety to parents.
According to the Academy of Pediatrics, the communication method used to discuss vaccines during routine well-child visits significantly influences the visit outcome. As future nurse practitioners, this topic is of great importance for two reasons. Without herd immunity, epidemics of vaccine-preventable diseases would recur, and vaccines obtained in childhood help children grow into healthy young adults. Parents rely on healthcare providers when making decisions involving their child's health. As the group retrieved data on vaccine-hesitant parents, one theme became clear. Effective communication strategies for healthcare providers with vaccine-hesitant parents is the way forward. For this research project, the group further explored evidence-based literature pertaining to communication techniques that healthcare providers utilize when interacting with vaccine-hesitant parents. We then analyzed the impact they have on the rate of vaccinations during childhood. Our group formulated the following PICO question. In vaccine-hesitant parents, how does the use of presumptive communication technique compared to the use of participatory communication technique by clinicians affect the rate of parental consent to vaccinations during childhood?
Initially, the team brainstormed and developed several keyword phrases pertaining to our PICOT question. Research was conducted via CINAHL and Medline through the Stony Brook University Health Sciences Library website. The first search through CINAHL yielded over 1,000 results. The group collaborated and worked together tirelessly on narrowing down the database search. The group utilized quotations around keywords and added Boolean operators. This narrowed down the search results to just under 300. Lastly, we applied limiters to our search consisting of publication type, date range within the past 5 years, age of study population, peer-reviewed articles, and articles using the English language to further narrow results. This resulted in a more manageable number of relevant and current articles to review. The group then conducted a second literature search via Medline and applied the same methodology as the first. The second search also resulted in a manageable number of relevant and current articles that discuss clinician use of presumptive versus participatory language with parents at well-child visits. Our research revealed that presumptive language conveys the assumption that the parent agrees to vaccinate their child during a well-child visit. An example of this type of communication between a parent and healthcare provider could be, "Your child is due for 2 vaccinations today, DTaP and hepatitis B." In comparison, participatory language involves questioning the parent about their thoughts on vaccines. An example of participatory communication by a clinician would be, "How do you feel about the vaccines your child needs today?" Researchers have found that providers who used presumptive language as opposed to participatory language were more likely to see acceptance of routine immunizations. In the participatory communication technique, listening and acknowledging parental concerns over vaccines can build trusting relationships between the vaccine-hesitant parent and provider. However, research shows it may not be the most effective method in swaying them to vaccinate their child.
When reviewing each article, the group kept in mind the process and importance of critically appraising research. First, the group deciphered levels of evidence for each referenced article. What constitutes the best evidence refers to the highest form of evidence available for a particular issue or question in the hierarchy of evidence. Next, each article was scored for research data within its body. Doing this enables the reader to review data and compare it to the other studies on the topic, thus allowing the reader to decide if the article is of use. The group selected articles that are useful sources of information and that are relevant to the group's PCOT question. Articles chosen were also peer-reviewed, evidence-based, and current within the past 5 years. Main data being analyzed was the use of presumptive communication versus participatory communication in comparison to vaccine acceptance and uptake through randomized control trials. All articles utilized inferential and descriptive statistics and were analyzed and arranged in a table format. This allowed the group to easily compare and contrast the group's research articles. The overall outcome of this research demonstrated that the use of presumptive communication amongst providers with vaccine-hesitant parents generated a positive correlation with vaccine acceptance, which was supported by statistically significant evidence. Descriptive and inferential statistics were used evenly throughout all articles. The outcome of the overall research represented a positive correlation between presumptive communication and vaccine acceptance. The outcome was supported by statistically significant evidence.
An outcome synthesis table was organized and generated to analyze and compare research that was discovered during the group's literature review. We were able to identify significance and compare the use of presumptive communication and participatory communication with the vaccine initiation or acceptance and vaccine series compliance of all articles to our PICO question. Furthermore, through research, the studies revealed that presumptive communication techniques used by healthcare providers resulted in higher odds of acceptance of vaccines. In comparison, participatory communication techniques used by healthcare providers offered a delay in the vaccine administration and potential for vaccine refusal. Approximately half of the articles used in research had potential threats to both the internal and external validity. When further comparison, additional research across larger populations as well as different vaccines should be studied to create a more generalizable result amongst the entire population being studied.
An essential component of a provider's practice is ensuring vaccines reach all patients in the appropriate time frame. If presumptive communication has been proven effective in the uptake of a controversial adolescent vaccine, such as the human papillomavirus vaccine, one could argue why not attempt this communication style for all childhood vaccines. The use of participatory communication with vaccine-hesitant parents can cause a delay in vaccine administration, as well as refusal over time. With the use of presumptive communication techniques, it is important for healthcare providers not to disregard the patient and parents' concerns about vaccine safety and efficacy. Through many studies, it has been found that the utilization of a combination of interventions increases vaccine acceptance. For example, some interventions included, but are not limited to, are the use of presumptive language, motivational interviewing, vaccine fact sheets,
and educational dialogue. These interventions can be utilized not only with the vaccine hesitant populations, but with vaccine eligible patients as well. In learning how to further develop and polish our research skills, we can make solid clinical decisions based upon evidence-based practice that supports improved health outcomes for our patients and their families. As future nurse practitioners, we are responsible for shaping the healthcare landscape. It is of great importance to take part in a multidisciplinary research team that will conduct and examine healthcare service outcomes at some point in our careers.